Hello everyone, my name is Kayla Alcorn and I would like to be an orthopedic surgery physician assistant. An orthopedic surgery PA can assist surgeons in pre, during, and post-op procedures. They can do patient charting, patient care, and even minor surgeries in the OR. The reason I became interested in being an orthopedic surgery PA is because I was interested in broken bones and I was interested in surgery. These two go together perfectly. I think that it's amazing that we can go and people can fracture themselves, have crushing injuries, and someone's able to go put them back together. It is extremely rewarding to get someone back to their normal lives and living the way that they want to live. There's a couple organizations that I looked up for physician assistants. One is the Physician Assistant in Orthopedic Surgery. This is a specialty program for anyone that's already in the PA field. This provides job forums. So one, the employer can post about what they're looking for, or someone that's recently graduated or looking for a new job can post positions that they can fill and employers can find them. They also offer discussion boards where physician assistants can talk to one another, ask questions, and discuss things that they may be unsure of. The continuing education through this program allows physician assistants to stay current on medical reviews and the current applications in medicine, which is extremely important. I did not join this program because it is for current PAs, and there are some students, but I didn't feel like I'd get the benefit of it. The next program is the American Association of Surgical Physician Assistants. This is a premier support group for all surgical PAs. You don't have to do orthopedics, you can be any type. This gives opportunities for furthering education by taking classes in any type of surgery if you want to see outside your field. It also allows for job opportunities for employers to post and employees to post what they're looking for. It's a great way to network and meet new people in the field. This also offers discussion boards where you can get viewpoints from any surgical standpoint as long as they're a physician assistant. I also did not join this program because I feel like I have too much schooling to go and it would not benefit me yet. To become a physician assistant, it's growing increased by 30%. Every single year, the need for PAs continues to grow and grow. The estimated salary for a PA is $101,480 a year. I have found on other websites that it seems to be closer to $98,000 and some are higher, but because it requires a master's degree, it does pay well. And it continues to grow, so the pay rate will continue to increase. It does take a lot of schooling to become a physician assistant. I looked up a few schools because it is a master's program. Once you obtain your master's degree in physician assistance, you have to pass the PANCE. The PANCE is a physician assistant nationally certifying exam. This makes sure that what you learned in school stuck with you and that you're safe to practice. California Baptist University does offer a master's in physician assistant, but it's a new program. In order to get into this program, you need to have a bachelor's degree, an overall GPA of 3.2, and 3 letters of recommendation. The Cal Baptist University PA program has not yet been accredited because it just started. Once the 2018 class graduates and passes the PANCE, California Baptist can become an accredited school. Next is Loma Linda University. They also require a bachelor's degree, but they require 2,000 patient hours, which is a little more than Cal Baptist. Loma Linda University has been around for a long time and it has been accredited. It's very hard to get into this university. They let 1,175 students apply a year and take 35 each year. But because they've been established so long, they have a 96% pass rate. Both Loma Linda and Cal Baptist University are 2-year programs, 1 year in the classroom and 1 year in clinics. The certifications that you need are a master's degree, and it's going to cost you about $100,000 a year. It's an expensive program, but it'll get you there. Most medical professionals do want you to have your CPR certificate as well, which can be obtained outside of the college. The upper division courses that I chose are movement exercise for children, nutrition science, applied exercise physiology, and fitness assessments and exercise prescription. I feel like all 4 of these would help me in my career because most people who broke bones or need an orthopedic surgeon have hurt themselves in sports or something athletic. The scholarly study of physician assistant. This takes a lot more than just knowing your medical stuff. I did a mock interview with Joe DiMattia, which is an internal medicine physician assistant. He made sure to let me know that you can't take things personally. You have to be able to show emotion and empathy and compassion to the patient, but you have to be able to leave it at the door. You can't bring it home with you. It's too draining on the body. In my mock interview with him, he did let me know that treating patients is a privilege, which is something I think most of us need to remember, because it's not they get to see us and it's their privilege. We get to treat them and we get to help make a difference in someone's life, which I think is a bigger deal. I also think that an active professional is something that most people could benefit from. It benefits our health, and we need to stay active to stay healthy. By knowing the field of kinesiology, it will help me as a physician assistant because I can teach them what they need to do for body movements, and I'll have a better understanding of how the body works. I also looked into faith while I was doing this. I think this really resonated with me working with faith because I do feel like I'm overwhelmed between work and school and home life, and that sometimes I don't have any extra minutes in the day. In this video, it shows that it's important to even take 1 minute to thank God for what you have, because He's the one that allows you to work. He has this plan for you. It's also important to thank Him for the opportunities that He gives you. And then if you're having a stressful day, you can always ask Him to help you get through it. He will work you through it and help you get to your end outcome. The other thing that I thought was very important is what you do matters. God cares about what you're doing and where you're working. He created these opportunities for you because they all are important in all aspects of life. Whether you're a janitor, picking up trash, or a doctor saving lives, God put you here to do that job, and you need to serve Him. He's proud of you, and He cares about what you're doing in your daily life. Thank you for watching.